Hi, James Brandel.
We got to keep this this meeting upbeat and exciting because I think it's going to be long.
We'll see. We'll see how far you get. A lot of people have asked, like, how late is this going to go? I don't know. I brought my chargers, so we're not limited by battery.
I think as long as it's going good and people are still awake, we just keep going.
All right.
I don't know. I've had a long day, so we'll see how long I hang in there.
Exactly.
I might be begging Mr. President, can we please stop now?
That's right.
It's like 40 to go through.
Oh my goodness, do we really?
Yeah.
Some of these you,
Yeah.
yeah, you're right. You're right. Oh, Joe, thanks a lot.
Yeah, maybe you don't have to do the ones at the bottom, but
Yeah, that's good. It's really,
still 19.
it's good if you can talk about those for a bit, but
Mhm.
we'll see.
That will probably be next week.
Yeah. Yeah, we'll take them. We'll go through these in the order that they appear in the book so that
Yeah. So
when
you
we
can talk-
stop, well, it'll be clear where we stopped.
Yeah.
Yeah.
Yeah, that's kind of what I did last time, or last couple of times, whatever. Just go through, just number it off, and it's a logical stop to, let's say it's around 7:30 and we're at number 18 or 19.
Okay.
Yes,
Boy, that'd be great.
it would be great. Because if we don't get to something like 18 or 19 today, that means we have to do 20 something next week.
But next week, you don't have to do all this other stuff. The first stuff.
Wow.
Next week, you don't have to worry about that. So you don't have to split it exactly in half.
Okay.
So it's okay.
But hopefully the first part of the meeting will be pretty, straightforward. I don't recall anything being a huge topic discussion.
Okay. I hope.
Yes, yeah. Let's go way through that.
Maybe my comments should be, hey,
Yeah,
and that's it.
What
Okay.
will be?
I practiced, so.
Okay.
Lynn, would y'all like us to sign into the meeting chat?
Yes,
Yes.
please. That with indicate your agency affiliation too. That helps us with the minutes a lot.
Okay.
We can. The other thing we can do is like ask each other. Was Claudia there?
No.
We can watch the meeting again, but sometimes people's names aren't quite complete on their Zoom identity. So if you put it in the chat, we're golden. And I am here at the Brookins Administrative Building in the Lyle Shields, or in the Shields Carter Room. And Joseph Omosage is here with me, Vice President of the Mental Health Board. This allows us to be fully compliant with the with the emergency revisions to the Open Meetings Act. This may be our last set of remote meetings. I know there's some discussion at the Illinois General Assembly. There might be something introduced that would allow remote meetings to continue under certain circumstances, but to my knowledge, we can't do this in May. So. And I've almost forgotten how to do this in person.
Yeah.
It'll be interesting. So, Dr. Joachim needs the link. So I think, yeah. Let me try to send that to him.
So I'm at home looking out my window and it is so windy out here in the country. And I heard my husband come in the house and say a not so nice word. I guess some of our shingles that he just fixed the other day are starting to flap again. I bet they're truly different ones. But so if anyone's out in the country, especially, stay safe. I hear tomorrow could be windy also.
Great. Okay. Whoops.
So welcome to Illinois.
Yeah, right. Illinois is giving us its best performance this week. I think, all right, I think that we have a quorum, and also right now, Dr. Joachim is joining, so we may be ready to go. At any rate, I'm going to put the link to the first packet, which is the official board packet, into the chat for anyone who doesn't have it, and then I'll put the link to the full program summary packet into the chat.
All right. Do you think we're ready? All right. Perfect. So I will call the Champaign County Mental Health Board meeting April 19th, 2023 to order. Can I get a roll call, please?
Matt Hausman,
Here.
Daphne Maurer, Molly McClay. Here. Joe Omosagie,
Here.
Elaine Palencia,
Here.
Jen Straub,
Here.
Jane Sprandel,
Here.
John Paul Joachim.
Here. All right. So with that, the next item on the agenda is the approval of the agenda. Do I have a motion to approve?
I move to approve the agenda.
Do I have a second?
I will
I'll
second it.
That's good.
I think Molly seconded it, and then can I get a roll call, please?
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Joachim.
Yes. So the next item is citizen input and public participation. All are welcome to attend the board meeting to observe and offer thoughts during this time. We'll limit public participation to 5 minutes per person and 20 minutes in total. If there's anyone that would like to make a comment, now is the time. And then Lynn, would this also be time for organizations to make comments? Because I see Claudia's hand up, so I was wondering.
Well, they can give input at public input. They also have an opportunity after we
Okay.
get through whatever of the program summaries you're able to get through tonight.
All right, perfect. All right, so I see Claudia's hand up. You just limit your time to 5 minutes. Thanks.
Yes, thank you so much. I'm not commenting on the grant application process. This is about something separate. My name is Claudia Lenhoff, and I'm the Executive Director of Champaign County Healthcare Consumers. And I just wanted to let people know that I just found out today that the owners of the former county nursing home have put in a request to the state to let them close down the nursing home. And so I believe that they can get this done in about 60 days. The staff were notified. So just in terms of our healthcare infrastructure, I just wanted to let people know what is going on. And I'm sorry to bring bad news to the meeting.
Thank you.
Thank you.
Thank you. Any other comments? All right, seeing none, I will move to the next item, which is just my comments. So I know we have a long meeting today, so I'll just try to keep it short. I do want to thank all the agencies that are here today and all the agencies that submitted applications. I know all the hard work that you guys put into making this possible, making your programs possible, and that your staff work very hard to accomplish all that they do. And whatever happens with the applications and the approvals for funding, just want to let everybody know that your work doesn't go unnoticed, and really appreciate all the effort and work and hard work that you guys put into making the community stronger and healthier. And then with that, I will move on to Lynn's comments.
A couple minutes before, I promised that my comments would be what?
Yay.
Yay, okay. Or something like, hi, everybody. And that's it, because you have so much to cover. So I'm done. Okay.
All right. With that, we'll move on to the approval of mental health board meeting minutes on pages 3 through 8. They're the meeting minutes from March 22nd, 2023, and the study session from March 29th, 2023. So I'll give everyone a minute or two to take a look at that and see if there's any addendums they would like or corrections. And I think Daphne Maurer has also joined the meeting as well.
Yes, hi.
All right. If there are any corrections or adjustments we need to make, please speak up. Otherwise, can I get a motion to approve the minutes?
I'll go ahead and move to approve the minutes from April 19th, or yeah, March 22nd and March 29th.
All right. I have Matt as the I'm moving for the motion. Do I have a second for the motion?
I'll second the motion.
All right. I have Elaine for second. Can I get a roll call, please?
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Joachim.
Yes. All right. With that, we move on to new business with the Mental Health Board fiscal year 2022 annual report.
Well, we have vendor invoice list.
Oh, sorry, I missed that. Thank you, Lynn. So sorry, the next item is actually the vendor invoice list, pages 9 through 12.
I had one question and I should know the answer to this. The Tolono Fun Days sponsorship, is that part of the Disability Expo like marketing plan?
Yeah.
You'd
So-
think I was on that committee, wouldn't you? Okay, I
Well-
thought so, but I wanted to double check.
No, that's a good question because we did that outside of committee. So you wouldn't know about it and nobody else would know about it. But importantly, that is a cost that gets split with the Developmental Disabilities Board through that admin share. So yeah. It's just us at a booth at Tolono Fun Days.
And that's fantastic.
All right. Any other questions on the vendor list? All right, and then there's action to accept this and place it on the file. So we'll need a motion to approve the vendor list. Do I have a motion?
I'll make a motion to accept the vendor list as presented.
All right, and then do I have a second?
I'll second.
All right, so Molly's second. Can I get a roll call, please?
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
John Paul Joachim.
Yes. All right, now we're on to new business. That is the Mental Health Board's fiscal year 2022 annual report on pages 13 through 52.
So you've seen most of the components of this before. John's letter, the president's letter, is something you haven't seen before. Here it is. And he did sign it, but we're having a problem with the Adobe Sign signature adds a page, which threw off the whole page count. So I don't know how I'm going to solve it, but I'll solve it. And then the other pieces that are new are these financial reports, which Chris Wilson prepared for us as soon as the county was done. The county auditor's office was done. But importantly, these are not audited yet. They will be audited soon, but the timeline, you have only a little bit of time to release this information to the public. And it's, you know, in recent years, it's been impossible to get the audit completed before that time frame. So these are new. And then the other pieces you've seen before, you've seen this at least once. I don't think there are any changes to it. And then the pie charts. Gosh, there's so many pages to this thing. Sorry. We're trying to be thorough. Okay, here we are. The appropriations pie charts, we showed those a couple months ago. I think the demographic and zip code pie charts are new, that you haven't seen them before. These are based on the data collected from agencies from July 1st of 2021 to June 30th of 2022. So it was kind of fitting them all into one page was kind of hard. Maybe I should stop trying to do that. And then the 3-year plan you've seen before, but I had to take some of the graphics out of the 3-year plan because they were keeping the document from being accessible. And we're trying to get everything accessible, or at least as accessible as we can. So I removed some of the graphics that were disrupting that. Otherwise, I should stop talking. See if you have any discussion or questions about this.
The only question I had was, so I guess for public information, once the audit is done, does that information get released to the public?
Yeah, the county audit it's a combined audit, and that is posted on the county site, and we're included in that. So I think someone is asking for a call-in number. Okay. I'm sorry. This is going to take, I need to answer a technical question for some people who are trying to call in. Anyway, the answer is yes, it'll be published on the county's website.
Thanks, Lynn. All right. So, you know, we do have a decision to make. So I guess, you know, I'll let everyone look at the report but you know, we have to move to approve we have to approve the annual report. Were there any question or discussion or comments that people had about it? I know we've gone over it a few times, you know. I don't think there's much new information, you know, other than the graphs. It was nice to see because it showed that, you know, we're serving a very diverse population, which is nice. But yeah, I don't have anything more to comment, but there's no discussion. We can move to just approve the fiscal 2022 fiscal year annual report. If someone wants to make the motion.
I'll make a motion to approve the Champaign County Mental Health Board fiscal year 2022 annual report.
All right. Do I have a second?
I'll second it.
All right. Can I get a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
John Paul Joachim.
Yes. All right. The next item is old business. So we're going to review applications for fiscal year 2024 funding on pages 53 through 54, and then the booklet as well.
Do you want me to put pages 53 and 54 up on the screen, or just jump into the booklet? Those are just a chart of the requests.
Yeah, I mean, I think we can just jump into it. and unless there's anybody that needs to see the list. But yeah, I'm fine with just jumping right into it. Do you want to just start with the first agency?
Oh my goodness, it's so big. It was supposed to be reduced a little bit. Okay. Oh, good. We did put the reviewers in like a little index here. So that's Jen Straub and Jane Sprandl right off the bat. And I don't know if you would like me to have the program summary on the screen or just people on the screen so you can all see each other, since this is a board discussion.
I mean, I think it's fine to have the program summary on the screen. I think we're all looking at it anyway, so.
Okay, well, you all let me know if you would prefer to see each other's faces. I can do that too.
All right, if Jen Straub wants to be the first reviewer.
Wow, you're really putting the new kid on the spot.
No pressure.
Maybe Jane could go first so I know kind of what the template is.
You know what? I would be happy to do that.
Thank you so
Don't
much.
say I never helped you. All right. So we're going to start with the Youth Assessment Center. They are requesting $76,350 this year, which is exactly what they have asked for in the past. So no increase. As we know, I mean, this is an agency we've worked with a long time. They've done, great things for the youth in our community. So it is a long-standing relationship we've had with them. Obviously, their biggest thing they're focusing on is early intervention and diversion services to youth. It happens to be particularly more minority males, and those overrepresented in the juvenile justice system. So again, when you look at some of the data, there are, larger numbers from the ages 13 to 18. African Americans, of the individuals assisted last year, 100 were African Americans, 78 were Caucasian. So there again, it's not totally, a racial thing, extremely one way or the other. So I think that's something good to note. I think media is not always our friend when we talk about young people in our communities. Many of these individuals come with complex trauma, and things like that. So some of the services they provide are screening for needs, risks, and protective things. They really focus on balanced and restorative justice, trying to encourage accountability for these young folks. So there are station adjustments done with them, weekly check-ins with case managers, which include oftentimes curfew checks, even checks with the school system, maybe writing apologies to folks. As far as who all is involved in this, a lot of times there are youth that are referred by police, schools, other agencies, and sometimes even families, that have said, hey, we need some help. They typically, within 21 days from referral, 75 of those individuals are assessed. Again, gosh, I wish it was a little bit higher, but when you have the numbers you do have it coming in, the caseloads that these individuals who are evaluating have, 75% isn't terrible, and so typically these individuals are getting help for about 3 to 6 months. So obviously they have targets and goals. The biggest one is, divert them from entering the juvenile detention system and, things like that. So there were a couple concerns about some numbers. I think they were just omitted. So if you happen to be looking on the measures of utilization page, for treatment plan clients, they had 100. For non-treatment plan clients, they had 150. Service contacts were 60. And then community service events, that number was 70. So that was another email I had gotten. The $76,350 request is for about 18% of their total program revenue. You know, as we know, the biggest thing is they serve hard to reach populations as well as working in rural areas to expand services beyond Champaign-Urbana. You know, they do have some work that they've done in Mahomet, Rantoul, and then other rural areas. At this point, as far as staff's recommendation, as we all went through these, we noticed there's several that didn't have the correct priority category. So this one would probably be safety and crisis stabilization would be their recommendation. But yeah, this seems like, you know, as always for them, a well-written request. Again, you know, they seem to be doing a great thing in our community. And so I feel pretty positive about this one. All right, Jen, what I missed?
Jane, you did better than I could have ever dreamed of.
Well, I am a talker.
All right. If there's nothing additional, then we can have any further discussion about this application. I mean, the only other thing I saw was, you know, obviously their audit was good, but like you said, this is high risk. These are high risk youth, and you know, I think with the amount of money that they are asking for, I think that it's high impact and cost effective, from my opinion, just looking at the application. But you know, I'm always happy to see what other board members have to say too.
So I'm always concerned about the discrepancy between the numbers. Yes, 100 African American youth and 78 white kids, and I think population-wise, we have it's not, the percentages are not the same, I think. So I just wonder how come are we over-policed, or is it
That is the main referral source,
Yeah.
is law enforcement.
so that's just always a concern to me.
And with that said, Joe, I guess I expected there to have been a bigger discrepancy. So I was like, well, not as, you know, so yeah. And then, like I said, I just feel like we all know there's some that seem to get a little bit harder rap, especially when it comes to media and things like that.
Yeah.
All right. If everyone's ready, we can move on to the next application, which is the CRIS Healthy Aging, Improving Family Caregiver Mental Health. I think Elaine was the primary presenter on this one, or reviewer.
Yeah.
I think her
See, and
Ooh,
is her video frozen.
yeah, looks like it, sounds like it.
Yeah, Elaine, you might want to try turning your camera off and see if that helps.
hear me?
Yeah,
Now
okay.
we can hear you. Yep.
You can hear me?
Yep.
Okay. Okay, we're going to the CRIS Healthy Aging program, Improving Family Caregiver Mental Health. This is a new request with an agency new to us, applying to us for the first time, and they want $125,000. This is The priority is closing the gaps in access and care, specifically in this program for unpaid caregivers of older adults. That's usually family members of people with dementia. And we're looking at the kind of social isolation and stress and burdens that these caregivers face. It also would serve the priorities of the IDD Special Initiatives Fund to strengthen the DSP workforce because they offered to assist that group with clients who have dementia, which of course is common in that population. So the priority is I think I said closing the gaps in access and care, as so many of these applications really are. It seems to be between that and case management are the two big things we're dealing with. So they're planning programs for peer support and art therapy and stress reduction. One of the things for the art therapy is something called a memory cafe, in which the caregiver and receiver interact with similar families through art therapy and music. And then there's training through a STAR-C model for the caregivers. One question I should am interested in with this is when we talk about, I usually associate Chris with Vermilion County, and so I know there's an office here, but how that breaks out if we fund this program, because I understand from the application that if some members in Champaign County, some people seeking this kind of program are nearer to Danville, they could be served there. But I think we need to keep an eye on our money being spent in Champaign County. Just something that would have to be built into the way that the reporting is done. When the staff looked at this program, which is hoping to serve 75 people with intensive services and 40 caregivers, non-treatment plan clients, our staff found that totals didn't match up. There were a lot of problems with the numbers and incomplete revenue and expense forms. So I don't know, they felt it was hard to assess, the budget because of these kinds of things. So that certainly would have to be dealt with. What we would be funding primarily would be personnel related costs. I was wondering though, just a question that I had, two questions. A budget surplus was identified for the agency, and the question arises, is our money as necessary, with that big a surplus, though? Are you asking for money for, perhaps that's a question for the agencies, for money for Champaign County that would be different and just dedicated to that? That's one question I have. And the other one is, do you already have a program like this, the Improving Family Caregiver Mental Health in Vermilion County, or is this a totally new concept that you're developing now for this market, so to speak? So if there's anybody from the agency,
this is Laura.
that could answer.
Sure. Hi, this is Laura from Chris Healthy Aging. Thanks for the opportunity to address you all. First, to your question about Danville versus Champaign, we do have two offices. We were just saying that if there was anyone who was in a more rural part of Champaign County who didn't want to make the drive, where our Vermilion County office was closer, they're welcome to use it. but we obviously understand that the funding would be exclusively for Champaign County residents. As we tried to explain in the application, we do have an existing program that is helping mental health consumers. It was and helping families of people with dementia. It was a federal grant, that and the funding is going away. So what we're looking to do is we've created a program that is doing good work, and we're looking to keep it going. So it is currently operating in both Champaign and Vermilion counties. And what we're looking was to maintain the Champaign County portion of the program, which is the larger portion of the program.
Okay, yes, I saw that expired, but I wasn't sure if it was the same exact, kind of makeup as the program you're presenting to us. So thank you for that information.
I mean, we are looking at focusing more on mental health. Our current funding source focused on the care received, was more focused on the dementia piece. So I think what we're looking at from your perspective as a mental health board is that our work really has become about improving the mental health of the care receiver. They come to us very burdened and stressed out and depressed, and we found that our work is having a therapeutic effect on that as well. So I think we are presenting it differently to you. I think the focus would be different. The focus would be on mental health.
All right. Well, then just additionally, I would say that I have also spent some time on the disabilities board. And one thing that I think the DD mental health part of our services has never been funded as highly as I think it should be. And so the idea that this might help the DSPs to be trained in this is very interesting to me, that part of it, because that's a real need.
We did, and the reason that we thought that, so I'm the program person, so I'm the person that handled the program piece of this application. And we did work with CrossPoint in Vermilion County, which is, a developmental disability provider in Vermilion County. And we had success with training some of their people. And we haven't been able to do that in Champaign County yet. So I think we really wanted to do that. We do have some ideas that were successful in Vermilion County that we would like to do in Champaign County too. Unfortunately, our work in Vermilion County was during the height of the COVID pandemic, and they had a huge staff turnover. So even though we were able to help their staff, they didn't stay. So we really want to have the opportunity to try again. And as for your questions that were about financial, I didn't do that piece. I know we have staff on the call who did. I know we submitted a in response to the concerns you raised, which were quite accurate. We did submit some supplemental materials to the board, such as our latest audit. We fixed the issues that were with the budget. So I think, I don't know if that was distributed to the group, but we did we did send some supplemental materials. I don't know.
Hang on, we don't, many have been tempted to share additional information after the review process when we don't really have time to incorporate it. So we don't share if it's additional information necessarily. We might share it with the reviewers so that they understand what's going on. But it's like extending the application period and for another segment of time. I think you did send you send that information to me?
I think our CFO would know that. Tiffany, do you know where it went? I just know that we specifically said this number doesn't make sense, and we
So what we so like that, it's great for us to have that information, but we don't share it at this point. We do share if we have made errors. We want to publish that as quickly as possible. So anyway, so if it was shared to me, thank you. I don't remember seeing it. Maybe it was, and
Hi, this is Kathy Dams, and I'm the Director of Grants Administration Research Operations at Carl, and I've been working with Chris on the application. We did send all revised financial forms, which address all of the concerns sort of laid out there. We got a grip on what was needed in the instructions, and we had the opportunity to put it into, a spreadsheet, designed to match the application. So I think that will answer questions about surplus, that will answer questions about our request and, you know, our contribution, the various things that are in there. And that's, you know, it was all sort of correction. There was no new material in there. The ask is the same. The commitment is the same. It's just trying to get our numbers out there.
Just for context, we have 40 applications to consider. We have a very quick turnaround time to review them. So when we have supplemental information, it's not usually incorporated, but thank you so much for sharing it.
Yeah.
I think I see it right now.
Okay. Yeah, I think I think we read the email that there was an opportunity to provide correcting information, so we tried to do that quickly. But yeah, we just wanted to make sure that you knew that that was out there and we had submitted it, and hopefully that resolves a lot of the questions.
Okay. That's all I have. Jen, do you want to add anything?
Only that I was very excited about the different assessment tools that were suggested for use, and I just think if we do end up funding this project, I would love to see the results. I'm super excited about the idea of this. This is definitely a gap within our community. Sorry, it's dinner time and the witching hour for my toddler. This is definitely a gap in the community that I see with, you know, our aging individuals. And I love the idea of supporting the family caregivers. As far as all of the financial details and served populations, I think you did a really great job, Elaine. I'm sorry, I'm so new to this.
All right. With that, we can move on to See You at Home. So I am the primary reviewer and Elaine is the secondary. So this is, you know, a program for the shelter case management. Oops, sorry, I'm on the wrong page here. So it's for shelter case management program. It's for $403,564. So the program provides intensive case management to help clients move from being in a crisis to stabilization and ultimately community integration. It provides a trauma-informed environment. It's a newly funded program. They help these clients and link them to outside resources, participate in group activities. There's a life skills program. There's a peer-to-peer support and mentoring. There is an advanced shelter for those coming out of substance abuse treatment, people involved in drug court or graduated the mid-barrier program. They work with the Urbana Police, Rosecrans, and GROW. The services are provided in 3 locations, and there's potentially a 4th that's being added. Rural clients are being served. If the client agrees, See You at Home can provide transportation to the shelter for the program, and they have to be 18 years and older. Usually 95% of the assessment of eligibility and need is done in 3 days. 90% will complete the assessment and engage services within 3 days. Typically, people are in the program for about 1 to 1.5 years. The clients get a pre and post survey to rate mental health, living skills, substance abuse, stress level, and physical health. With the outcomes that they monitor, about 70% report improved mental health and less stress. 80% have improved independent living skills. 60% report less substance abuse and improvement in overall physical health. They project to have about 55 treatment plan clients. For non-treatment plan clients, it's clients assisted through groups, transportation, or limited case management services. They plan to have about 25 of those. And then for service contacts, they project to have about 5,500, which is case managers to have about 3, service contacts per week per client plus additional support. And then they're using other funding from grants and donations to assist in this funding. And it's good that they're looking for other resources of funding. There's a 57% increase in the proposal change in funding from PY 2023 to 2024. The funding is to cover the cost of new staff. And then the comments were that the salaries are well within reason for social work and the director. They're funding 3 full-time case managers, 1 lead case manager, and 1 life skills member. So obviously this is a program that's asking for a lot of money. It's a new request. It seems like they are, if we do fund this, they are going to be doing a lot with that money, obviously. It looks like it would likely have a large impact on the homeless population. And there are those requiring a case seeking case management that are needing intense case management. So I would love to fund this. Obviously, this is a year that I'm not sure if we're going to be able to fund everything. So definitely this is something we're going to have to discuss, but it seems like a great program. And then I don't know if Elaine had any other comments.
My only comment was just to point out, it looks like See You at Home is aware of connecting with other similar programs to help this population. And in former years, we've worried a lot about silos, and I think the agencies are slowly overcoming that problem. And so I was glad to see that they are, in touch with other service providers to the homeless. And our booklet suggests that since they don't participate in Medicaid programs, they could direct some eligible clients to other organizations where that could be used. And so I just wanted to point that out as a good idea as people collaborate to solve this issue. And that's all I had.
All right. With that, we will move on to the next application, which is See You Early, the program See You Early. So I think Matt was the primary reviewer.
Okay, yes. So See You Early. This is a new request to the Mental Health Board for $77,184. See You Early is it is a longstanding agency. Very good program. I've actually worked with Kelly and See You Early in the past. And they are a home visit program. They support prenatal through 3 years of age, mostly in the Champaign-Urbana area, and then help kind of guide them into the Urbana School District and some into the Champaign School District, where they pass on to the early program there once they get into the 4-year age. They're currently supporting, based on this application, I believe it's 85 families, if I understand. The reason for this request is that they had received word that ISBE, so state funding, is going to be frozen for the next couple of years. And so they have 5 full-time employees doing these home visits to these families, and they need support to support one of those full-time employees doing these home visits. I believe they noted 3, this would be for a bilingual home service provider. I think they said they already had a waiting list of 3 families, Spanish-speaking families, that would benefit from this. I'm not going to go too much into the details about this because I do have a couple of questions for Kelly. I thought I saw Kelly on the call.
I'm here.
Okay.
I'm
Hi,
here.
Kelly.
Hi,
How you
Matt.
doing?
Nice to see you again. Thank you for having me here tonight.
Yeah. So the first one is related to this ISBE funding. So you said you've received word that it's going to be flat for the next couple of years.
Correct.
What would be, do you have any idea on longer term? Would this be something that it would potentially be that where we potentially have to do further support of this?
So it's my understanding that we are going to remain at level funding for the next 2 years. The next 2 years after that, we will have the opportunity to write for another competitive grant.
Okay. All right. That's good to know. The other one is, this is kind of going to be a little difficult question, and it's, at least I already gave Lynn a heads up on this. I don't know if she passed it on to you. So going through this, as I said, this is for a Spanish bilingual home visit. You noted in the application, there are currently only 3 in the entire consortium of home visitors. There are 3. Was it?
Go ahead. I'm sorry. Go ahead.
It
Go
sounded
ahead.
like there were, for all the agencies as part of the home visiting consortium, that there are 3 home visiting people who are bilingual, and CU Early has 2 of them. Is that correct?
So it is correct that CU Early currently has 2, and we have long-term bilingual staff. With the other 7 home visiting programs that serve children birth to 3, it's a little bit more fluid with their Spanish-speaking staff.
Okay.
I am sure that they can attest the difficulty of finding bilingual staff who have early childhood and child development backgrounds who are able to speak Spanish has been a challenge for our programs. And luckily, CU Early, we have long-term staff who speak Spanish, and we've been able to serve currently 53% of our enrollment are Spanish-speaking families. So we have served birth to 3 families long-term in this community.
And it's also important to note from the application that this is one of the good things about the program, that the highest priority includes things like homelessness, domestic violence, substance abuse, English language learning as part of that to get to the highest priority emphasis. Now, the big concern, and this is a big picture concern for the entire county and the entire consortium, not related to just CU Early, and this is where I'm concerned I'm going to be opening up a can of worms here, is, as you noted in the application, that the consortium, the different agencies have different niches and different little focus areas. And so as I was reading this on the application, I was concerned about, okay, if CU Early has the kind of the majority of the Spanish-speaking families because of that, what happens if there is a Spanish-speaking family that, if they weren't Spanish-speaking, if they were an English-speaking family, they would be placed into one of the other niche programs. And sure enough, as I was reviewing another application coming up, which was the Crisis Nursery program, they actually explicitly stated that they had a Spanish-speaking staff member to help out with their, what was it, Beyond Blue program. But they no longer have that staff member, so they are currently trying to fill that role to help the bilingual for that specific niche, so to speak, is the language that was used. So again, this is a broader conversation. I brought this up with Lynn as far as making sure that we have, that we're supporting the Spanish-speaking families that might have other niche needs outside of CU Early. So with that, again, very loaded question. Is that something where that you can support those niche?
The consortium, the Champaign County Home Visiting Consortium, for those of you that don't know, consists of 8 home visiting programs, birth to 3 in Champaign County, and a couple of those programs also serve children 3 to 5. We work very well together collaboratively to share referrals, and we want to ensure best fit based on family's choice. So we're going to, we work together, we meet monthly, we share referrals, we have a coordinated system of referrals. And frankly, most of the Spanish-speaking families do come to CU Early because of the stability with the Spanish-speaking staff within our program. And we connect, not only do we work on child development and parent education and support, but our home visitors look at our families comprehensively, and we connect our families to other resources in the community that can help them. So we're very familiar with all of the resources in the community that help Spanish-speaking families.
Okay, again, one of those things I want to make sure we're not giving you the funding for this program, and we might in turn be kind of withholding some potential support from Crisis Nursery or another. So it's just wanting to look at that big picture and make sure we've got everything covered.
Hopefully that answered your question. Again, we work very collaboratively together.
Okay. I think those were my main points on that. So John, I think you were the secondary, right?
Yeah, I can't remember if I read this in the original application, but these families, they are not delayed enough to delayed enough to meet the eligibility requirements for early intervention program, correct?
So in our program, we do developmental screenings to determine if children need additional support to early intervention. So we help with the referral process to early intervention. We're like the first point of contact. If we do a screening and we find that there's a concern with a child's development, or if a parent says to us, I'm concerned about my child's development, we help them with a screening and then refer to early intervention if that's needed. So and then once they get into early intervention, if they qualify, our home visitors work with those developmental therapists to ensure that their IFSP goals are being implemented.
Excellent, thank you. You know, I honestly, I think this is a great program. And Amy Frund is one of your employees, right? Yeah.
She's one of our long-term bilingual staff. We're very, very fortunate to have Amy Frund on our staff.
So, just speaking from experience as a pediatrician, she is literally, I can't imagine not having her as a resource in this community. Like the way the families interact with her, you can just tell, like, she's pretty much like a part of their family. When she comes in with those families to their medical visits even, and helps like, she doesn't need to come in to translate. We have translators and everything, but she'll come in and translate with the family, play with the kids, and just talk about the mom's concerns or the parents' concerns. And you can just tell she has a great rapport with all of these families, that they're all very close. So I can see why a lot of Spanish-speaking families, even if there are other Spanish-speaking people in other programs, why they would come to see you early. Just like her, just if she's any representation of your program, it just speaks volumes for the program. So she's a great representative of that program. You can just tell the family just love her.
I agree.
You can tell they value her as a resource, and they feel very comfortable asking her questions to ask the other people, ask doctors, ask social workers, things like that.
So she's a very strong advocate for all of her families, and families in the community seek her out. So we're very, very fortunate to have Amy Frund on our staff, and I will share that with her. So thank you for that.
Well, thank you. So yeah, with that, I don't have anything else to add. I think it's a great program. So,
thank you.
So the next application will be the Children's Advocacy Center. I think Jane was primary and Matt was secondary.
Might be on the wrong page. I'm so sorry. Nope, I'm on the wrong page.
Okay. Nope, you're good. I couldn't get my pages all. Let's see here.
Here it is.
Oh my goodness. All right, so I am going to start, and then I may have some questions, or actually I'll probably start, let my partner in crime discuss, and then I may have some questions. So Champaign County Children's Advocacy Center is requesting $63,911, which is a 13% increase. Last year we funded them for $56,425. You know, again, this is a long-term program we have had that we've partnered with. You know, they focus on children ages 3 to 18 who have allegedly experienced sexual and serious physical abuse. Part of what they do is they work with child forensic interviews, coordinating, you know, screenings, counseling, advocacy, you know, all those types of things. They are located at the CU Public Health Department entrance, and that is locked. And they do use local counseling services, you know, to help with therapy for these individuals. And there's offices in Champaign, Rantoul, Savoy. They also can do virtual counseling if that works better. In the year 2022, they serviced 198 folks, which seems like a lot to me. You know, it's a great thing they're doing, but for terrible reasons. Most of the referrals come from law enforcement or DCFS. Within 1 day, 90% of these children are assessed. And within 2 days, they are engaged in some kind of services. Average length that folks are receiving services is 6 to 12 months. They were missing some totals as far as like how many treatment plan clients they had and stuff like that. I'm sure that's something we will get in the future. Of their total agency revenue, we're only supporting 19.8%. And part of the reason for a higher request is, I'm sure most of us heard, the Victims of Crime Assistance Grant has been cut. So with the reduction of that funding, they have to come up with that money. And potentially, and I don't mean to misquote, but I'm pretty sure I saw somewhere that would mean 177 fewer hours of counseling would be available due to those cuts. I mean, a lot of this is stuff that, you know, we have, you know, obviously been through. I think the biggest thing that really weighed on me is the fact that there are, you know, they're going to have to probably cut some services potentially due to this grant being cut. I do know they are trying to seek out some local assistance. It was recommended maybe we offer a 2-year term, and that led me to one of my questions of, you know, what if these grants are cut more? Are they going to want to maybe need more money next year? So I will let my partner kind of go through some stuff, and then we maybe can open it up for some answers, or if anyone else has any questions, because this was one that I was like, wow, there's a lot to think about on this one.
Yeah, really all I have to offer, Jane did a great job going over the general overview. And as she mentioned, the VOCA cut funding. And so what was noted by staff looking ahead is making sure that, and this is the me being the bean counter, I guess, so to speak, is that we are supposed to be the funder of last resort. That we're making sure nothing goes into a reserve fund or anything like that. The other aspect of that is they also serve Ford County, so that is something else that'll go into consideration. But I'll definitely defer to staff recommendations on those specifics. But that is just another aspect of this funding request that we will have to consider.
Thank you.
I supposed to talk?
don't have to, we can, if there aren't questions, we can move on.
Okay,
Thank you, Carrie.
thank you.
All right, with that, we can move on to the next application, which is the Christian Health Center Mental Health Care at CCMHB. I think
Okay.
Joe and Daphne were the reviewers.
Yeah, that would be me. To me, the fact that mental health is separated from health is still a problem. Mental health is health. So, and the fact that we have underinsured or uninsured people seeking healthcare is something that we as a society ought to think about a lot. They're asking, the request is for $33,000. It's a 0% increase for the amount of work they do or for what they want to do. I think it's relatively small. And the fact that we still have underinsured people, they want to address the gaps, and no matter how much we put a basket together, there would still be gaps and people will still fall through the gaps because it's not healthcare for all. So, and a lot of the people that they work with are recently released prisoners, low income populations of unmet health needs. I mean, I think part of it is that mental health becomes an issue when other health care needs are not being met. And we have to consider ourselves as a society that cares about the whole person, not just that one person. I see the questions. I don't have any questions. I mean, I like the fact that they will take pretty much anybody that walks through the doors, and that's a good thing. And I would like to see all people have access to mental health care. I mean, the personnel related costs are relatively low, and they want to provide services, and those services are things that are definitely needed by the society and by the community that we live in, looking at the client population that they serve. A holistic approach is necessary because people coming in from wherever, you have to look at the whole person and look at what services you can provide for them where they are so that they can go and meet the places where they want to be. I don't have anything else to add. If Daphne, you have anything to add, go ahead, please.
I do not. Thank you.
Any questions for the Christian Mental Health Center?
Leave it on there, sorry.
If not, let's move on.
All right.
All right.
I apologize. I have to go lock the door. I forgot.
Go ahead.
So,
It's all right. We'll hold on the fort while you're gone.
you got it.
I know Kung Fu. It's okay.
So the next one is the Champaign County Healthcare Consumers, CHW Outreach and Benefit Enrollment. So Elaine and I were the reviewers.
Yeah. Okay. They're asking for a 13.4% increase over last year for of $91,054, and are asking for a 2-year contract. This is their priority was has been innovative practices, but as I said, case management is kind of becoming a norm, and so closing gaps in access and care would also be an appropriate priority. They are helping with benefit enrollment and outreach to people with mental health or substance use disorder issues. They can be self-identified, and this program helps them enroll in medical plans and SNAP and advocacy. They advocate for other services as well. They served 191 folks in 2022 and 83 in the first half of 2023. So they're one of the important things about this program is that it can be ongoing for years because there's re-enrollment involved in a lot of the services, the healthcare services, and it's absolutely crucial. Anybody who has dealt with medical bureaucracies knows that it's bad enough if you don't have any other issues of your own to work through. And so this has been a program that has done a lot of good. I think they have good tracking, and their targets are for the next fiscal year is 160 treatment plan clients, and then 25 non-treatment, and they do and service contacts 780. So I think this has been a very, very good program, and most of the costs that will be asked of us are personnel related, because they had, those increases. One thing I like about this program is that they do warm referrals. Our staff noted how detailed the budget narrative is. Their counselors these CHWs are federally certified application counselors. So this is a well-run program that is run with expertise, and has, I think, this is not the only one they do like that either. There'll be others gotten to. So I have always been impressed with their presentations about the work they do. Now, I don't have any questions.
I think Elaine did a great job presenting. I don't really have much to add. Just, basically reiterating what she said, that this program helps people that have trouble enrolling in health insurance or other benefit programs, and helps them get enrolled and apply for these programs. And even from someone who is in the medical field, applying for these things is not easy. So I don't know how other people do it without some kind of assistance from someone who is well versed in doing this stuff. If you read the application, it says on average, each client typically requires assistance with 2 applications, but some require as many as 5 application assistance. And so, it just goes to show that, they're well versed in a variety of programs, and they're experienced to do these kind of enrollments for these individuals that need this assistance. So I think in the long run, it's cost saving for the county to fund this program, because it gives them access to, benefits that otherwise, they'll be using the emergency room and not having access to healthcare, not having more food insecurity, and a lot of other issues that come with that. So that's all I have to say. All right. With that, we'll go on to the next program with the Champaign County Healthcare Consumers, which is the Justice Involved CHW Services and Benefits.
Hi, this is Daphne Maurer. And so with the Justice Involved Community Health Workers Services and Benefits, I read that it's they want a 2-year, and this is continued funding. And the request is for $94,892. And that is an increase over last year of 22.6%. and it's for due to the cost of living increase and higher health insurance costs for staff. Then personnel also. Then this program is to help those who have been involved in the criminal justice system and who may be experiencing behavioral health issues, including mental health or substance use disorder. And they are helping those in the community with mental health issues. They've been involved with the criminal justice system, as I mentioned, and basically getting these people on track with getting insurance coverage, and then other access to care or access to things that they might need to make a successful reentry, and to reduce relapse and reoffending. And basically, when people leave the jail with Medicaid coverage, they're more likely to seek the care that they need. So the crisis health worker, the justice crisis health worker goes into the jail to help, and they work with Rose Grants on that. They've listed organizations with whom they have written agreements. They will also be in the Rosecrans office, the northern Champaign County area, at Rantoul, the Daily Bread, and will also use communication via third parties if they need to. So we can see here that the people that have been served and the demographics, and this is during program year 2022, the African American people served were 41 and white were 61. And gender, male 111 and female 13. So criteria they're going to use to evaluate this would be the results from those that do get insurance and access to other resources, as well as an intake form, which staff tracks outcomes for each client. They'll have regular client encounters to have outcome data. And then our staff says that these outcomes relate to positive impacts on people served. There's one assessment tool, and the targets are essentially yes or no rather than percentage changes. So the measures of utilization, treatment plan clients, 75 people using more than one contact, possible case management needs. Non-treatment program clients are those in low intensity service use with one contract for information, or established clients who continue to meet criteria but are self-sufficient, and then others who are not eligible for Medicaid or SNAP due to sentencing to IDOC. Service contacts would be 200 contacts with those served, 8 community service events, and then other was possibly to use a prescription drug fund. Staff comments that the proposal offers more detail on the use of each service category, which it does. And then the other count appears to be missing, which it is under the measures of utilization. Due to its nature, this could be left without a target number. I agree. So basically, with regard to staff comments for the financial analysis, increased in request relates primarily to cost of living increase and higher health insurance costs for staff. And then with regard to the cultural and linguistic competence plan, the agency has provided quite a bit of information on that. They do provide in the very beginning of their application and that they've worked with other grant funders. And then they have a way that they've talked about how they contract formally with Rosecrans and the county jail. And then they have warm referrals with Promise and OSF's community health center. And then they work closely with township offices and coordinate with the IDOC to get the number of people or the list of people being released to our community so they can reach out to them as they start in re-entry. They have an evidence-based review. They were able to reach out to rural and underserved populations, including historically underinvested. And then they, like I said, they've been in the jail and then other places as well. I don't know if my cohort has anything to say. I think it's a good program for sure, and it should be funded.
I just wanted to mention that in addition to SNAP, which is food assistance, and Medicaid or marketplace plans, depending, one of the things that this program helps to provide is access to SafeLink phones or Obama phones, which I was happy to see because, you know, just of note, when people are coming out of incarceration, in order to get a job or in order to get housing or in order to just access your support system, you really need a way to communicate. So that was great. Other than that, I think Daphne did a really great job. Just of note, we would be the only funders for this program. I think that's all I got.
All right. With that, we can move on to the next application, which is the Community Service Center of Northern Champaign County.
I'll just go ahead and get started. I think since we're living a very much of a car culture where transportation is always a problem when you don't have resources, this organization helps to bridge some of those gaps and hopes to close the gaps for food and several other things. I'll just read directly from the program. It offers space for other agencies to provide mental health services, a food pantry for all county residents, utility and prescription assistance, referral for clothing and school supplies, senior transportation, youth recreation, and vouchers for eligible families, holiday food. So it's a big umbrella for lots of different organizations in the northern Champaign County. It's housed in Rantoul. They're asking for a 9.4% increase in funding, and our funding will be 25.8 or 29% of their total funding, and it tries to do quite a bit with what it has and offers an opportunity for lots of interagency collaboration because there's opportunity and space to do everything. The pantry is open for quite a long time, and the office is open for quite a good long time also. Mental health services are provided there, or reach out to other parts of the county. When you live in a rural area in this county, I mean, transportation is an issue. 52% of the clients are minority, and many of them lack transportation. So there's that isolation. And one of the things that we've learned through the pandemic is that isolation creates also a mental health concern. So this organization tries to make those connections possible. That's really what I emphasize. I looked to it to see as a part of emphasis of what they provide. That big umbrella where lots of interagency collaboration is available to everyone. Mm-hmm. One number that struck out to me was the under 18. There were 3 people under the age of 18 that sought services. And I'm saying, okay, maybe it's just me again, but as a society, how do we have children seeking services on their own? Mm-hmm. Who was my co-leader? It's okay, I can't remember.
Oh, yeah, I'm Daphne.
Daphne, do you have anything to add?
I just think that it's important to note that there aren't other related services or supports available to this target population. So I think that that's something important to consider when we're looking at funding this program.
All right. With that, we'll go on to Crisis Nursery Beyond Blue of Champaign County. We got Matt and Daphne.
Okay. Yep. So a lot of us are really familiar with Crisis Nursery and all the great work they do in the community. This specific program, Beyond Blue, is supporting, I'll go ahead and just read directly, support to mothers experiencing perinatal depression, focused on mental health and well-being of children and families by strengthening the parent-child guide bond through play groups, support groups, and home visiting services. So this is a continued funding. We funded 90,000 in the past. This is a request for an increase to 100,000. That increase is due to, like many increases, due to the general upward pressure of the employment market. To cover that, this specific funding would cover the equivalent of 1.4 the family specialist position to support this support. Something I really appreciate about Crisis Nursery is they very much try to provide countywide service to as many people as possible. They focused about their service to rural communities and underserved communities. I had mentioned earlier in the meeting about the offer, trying to recruit bilingual staff so they can make sure to offer the support to Spanish-speaking families. Trying to remember, is there any other notes I had? Another important thing to note, and Daphne actually just mentioned it previously, that since the pandemic, there are no other agencies or services similar to this being provided in the county. So this is a kind of the one place to get this service. They are getting grants and other funding from other sources. And yeah, we've worked with Crisis Nursery a lot, and their applications seem to be in great order, having all the details about all their credentials and everything. Yeah, that's. Don't really think we need to go too far down that. Daphne, if you have anything to add, I think you were the secondary.
Yeah, I agree. It's very well put together, organized, and informative.
All right. The next application is DSC Family Development. It's Jen and I were the reviewers for that one.
All right, I think I got the basic template. So this request would fill gaps in early detection and intervention services for myriad services that's not currently able to be billable by the state or other funding avenues. It meets families and their children that are 0 to 6 where they are, whether it's at home, a child care center, or other public place. They provide screenings and other assessments. EI services, play groups, OT, PT, wraparound support for families, really just a huge birth of services, which we know with busy families, sometimes it's very hard to make all of those appointments. So the idea that these people were coming to you as a parent of young children just seems really nice. Like, I feel a load off my shoulders, even though I have nothing to do with this. They served 815 people in 2020 in 2022 and 592 in the first half of 23. The majority being from Champaign, but also hefty 109 from Urbana and 108 from Rantoul, also Mahomet and other places within the county. The majority of the kids 0 to 6 are white, but 532 are white, 154 are black, and 33 are Asian. Seems like they're reaching out to a lot of different agencies and working with a lot of different agencies here. Within 14 days of referral, 100% of these kids are going to be assessed, which is amazing. Kind of in this climate, I think. Within 30 days of assessment, 100% of those assessed want to engage in services. And now my cat is wanting to come into my office because chaos. They're asking for a 10% increase. They're asking for $656,174, which is about 2/3 of their budget. Right now they're getting $596,522, which is, it's a 10% increase. Mostly, we had something about that here that I made a note of, but it's gone. The increase relates to increased salary and benefits. But again, I think I'm going to let John make more comments on this because this is my first go at it, but it seems like a really solid program.
So basically, this is kind of bridging the gap that early intervention state program isn't able to fill. So usually early intervention provides home services for speech therapy, development. So like, say you have a child who you think if your child might have some developmental delay, like speech delay or fine motor delay or gross motor delay or developmental delay, you would call the early intervention number. They would, the state early intervention program would come to the house, do an assessment, and basically say whether or not you qualify. Well, you have to be, you can't just be a little, you can't be just mildly delayed or 20% delayed. You have to be 30% delayed to get speech therapy or whatever other therapies you qualify for at the home. And then they would continue therapy services, or this is the state early intervention program, until you are 3 years old, and then they would transition you into the school system. And so that's great. And unfortunately, there's a long waiting list in a lot of places, especially in Champaign, a lot of places in Champaign County. It takes months to get like a speech therapist sometimes. And especially if you're like Spanish speaking right now. That being said, that leaves a lot of families who have children with delays that do not qualify then for services. So they're like, well, they're delayed, but they're not delayed enough to get into early intervention. So they said, oh, we'll reassess in a couple months and see if they're catching up or if they're behind enough that they can qualify for services. So this is great that we've been able to fund a program like this. Obviously, it's not cheap because you're funding 1.5 full-time speech therapists, 1 full-time physical therapist, 1 occupational therapist, 4 developmental therapists, and 1 developmental screening specialist. So that costs money. But that being said, they treat a lot of people in the community. So we are getting a lot of bang for our buck. And they serve and have reached to 21 different towns and villages in the county. So I know it's a lot of money, but it's worth it if we can afford it. I know I was concerned about like the long-term viability of being able to fund this in the long term. Right now, it seems like we can, but it seems like when I was talking with Lynn, it's because of one of the priorities, because of the priority that the gap that's fitting in. It seems like we're able to afford it because there aren't other organizations funding the priority that it's that's selected. So I'm glad we're able to afford this, and I think we should fund this so that children don't fall behind. Because I don't know if I'm sure a lot of you know, but as a pediatrician, I always say in the office with my families, if you had to pick one important factor in in a person's life and whether or not they're going to be successful, it's their reading level in the third grade. And the reason for that is after third grade, you're no longer learning to read, you're reading to learn math, to learn history, to learn science. And if you're behind at that point, it's really hard to catch up. And so one of the important factors in whether or not you're going to have a higher or have a good reading level at the third grade is really your vocabulary when you enter school. And kids who are behind when they enter school, it sets them back. So if they can get, especially speech therapy, which I'm glad they have 1.5 full-time speech therapists, if we can catch those kids up before school, we're really helping the community long-term and saving ourselves money and making our community more successful and more likely to thrive. So that's what I have to say.
Amen.
John, did you want me to share, since there are some newer members on the board, what we talked about?
Yeah, sure. Mm-hmm.
It's in the intergovernmental agreement between the Mental Health Board and the Developmental Disabilities Board, which was initially developed when the DD Board was established, because the Mental Health Board by statute has an obligation to DD services. So when the DD Board was established, they worked out how much of the Mental Health Board funding should be directed to DD, and there's a calculation we use each year to update that. So that's the whole, like, on the DD side of things, we have, fewer agencies operating in the county than we used to.
Mhm.
So it is, we're quite lucky compared to some areas of the state. Anyway, that's the whole thing. Okay.
Thank you for just making it more understandable than what I could say. So thank you. Or explaining it better than I can explain. So the next application is Don Moyer Boys and Girls Club. So there's 4 of them. So the first one is See You Change with Matt and Jane.
All right, I think I'm off mute now. So yeah, so See You Change. This is another repeat program. No change in funding, still $100,000 request. The program supports youth at risk with mental health and case management services, designed to take on issues encountered in the educational setting, social settings, family, and community. Focus on graduating high school and plan for the future. So yes. This is mostly for Champaign-Urbana residents, a few in Rantoul. Do we have anyone from the Boys and Girls Club on the call? Just because there was one thing that seemed a little between the staff comments and the application I was a little confused about. So we had a staff comment that said a shift of service location from home to the club, where in the application, I noticed a lot of them talking about a lot of services being able to be met at home. So that kind of, I will, if I could get some clarification from either, I don't know who reviewed it from the mental health board staff about that. I just was confused about that switch.
Can you tell me which page?
On the staff review, it was page 56.
Oh,
So
okay.
shift of service. Yeah, right there.
There we go.
Service from location from home to the club, but it seemed like in the application. So I don't know if I missed something.
We had a number of people reviewing that. So I did everything passed through to everything and set up these, and then got input from all the rest of the staff and a consultant reviewer who reviewed a subset of the applications, including this one. But this could have been, if Leon Bryson is still available, this might have been one of his comments.
Hello, I'm still here. Yes, this was one of my comments. And so what I was wanting to find out was, I know that this program typically goes out into the community because it's dealing with intensive case management. And so that's should be the goal, instead of bringing a lot of the youth back into the club. And so that was just my one of my concerns that I had. So,
okay.
Yeah.
Okay.
If that makes sense.
Yeah, that's why I was, because it sounded like they did offer a lot of the services at home, but okay, so this was more of a concern that we wanted to make sure that they are continuing to offer that in the homes. Okay.
And Leon, was this also a concern of the separate reviewer?
Yes.
Thank you.
All right. So yeah, that was it. Other aspects of it, numbers wise, so it looks like they were expecting about 50 youth to be enrolled in this program, with some graduating in and out. Some other stuff. This is to charge for the salaries of 2 full-time staff. See if there's anything else. The one thing I noticed, or that that Leon and staff had noticed on this, there did seem to be quite a few discrepancies within the report as far as the financials. So hopefully we're working on getting that clarified with them, just so we can get all that cleaned up. Just different numbers didn't add up in different areas. Yeah, also it was pointed out that the Boys and Girls Club has had some staff turnover there, so making sure, since this is funding staff, that that is accounted for when we do the final allocation for this. So I'm trying to think if there's any other notes I had. One other note that was made by staff was looking at the community events target seemed rather high. I think they had 125 or something like that, and I kind of agree with the staff. That does seem like a really high number for those types of events. So working with them to kind of maybe retarget that. So yep, those were the notes I had from my review.
I really don't have a whole lot to add. Again, Matt touched on, there's been some turnover. Again, I think sometimes when there's turnover, sometimes, numbers and data gets a little skewed. So I'm sure that's something they're working on, kind of freshening up. Another staff comment, and I don't think Matt said it, and if you did, I apologize, is on page 57, they have a lot of outcomes and targets, and the staff said, maybe they need to zero in a little bit, because it's kind of like when you're goal setting at the beginning of the year, you can't do everything in the first week of the year. So, maybe they just need to narrow those down just a tiny bit. Other than that, I thought it looked great. It's a great organization, just a little bit of freshening up needs to be done, and sorry for the barking dogs.
Matt and Jane, hi, I'm Monica. I am the new director of operations at the Boys and Girls Club. So I did want to just kind of take an opportunity to speak on some of those questions just because I'm here. We, as I'm sure many folks know on this call, we have recently welcomed in a new CEO, Amy Brown. She's on the call as well, and are doing a lot of cleaning up and a lot of freshening up to make sure that we're offering the highest level of services moving forward. To the questions about in-homes, yes, nothing is changing as far as the way that we're offering services. We're going to continue to allow that flexibility for our case managers to go where they need to go to meet these children and youth and families where they are. We do have a little bit of a shift in the way that we are structuring the program. Before we were had a kind of like a program manager that did some case management as well as another case manager. Now we're just going to have 2 case managers, and they're going to focus on serving the families, and I'm going to focus on doing the oversight of the program, so we can make sure that we are meeting our targets, so that we can make sure that we are looking at our outcomes and what we can hit and what we cannot, and just being really specific and intentional about what we're doing moving forward here.
Thank you, Monica.
Ready for the next one?
Yep, I think we're ready for the next one. So I think Jane, you're up again for the CUNC on the Don Moyer Boys and Girls Club, and with Molly as well.
Doggone it. I was thinking I'd already passed this one. Okay. So this is again a continuance of funding of a current program. So we are looking at a 20.3% increase. Currently they're doing 110,000. They're asking for 132,322. I think there was a couple of numbers maybe transposed, so we don't have a final number on if it's 132,322 or 131,322, but we'll get that ironed out. So they do subcontract with CU Trauma and Resilience. So they're really focusing on young adults ages 16 through 30 impacted by adverse community experiences. So this is where they're trying to work with adults, you know, primarily with 45 and over with unmet mental behavior health and or addiction needs in neighborhoods impacted by structural inequalities, and individuals adversely impacted by long COVID. And there are community level peer leaders that are kind of helping facilitate some of this. So they're really doing a variety of education, training, workshops to support not only individuals, but families or groups that are affected by traumatic events. So this really fills in the gaps in training and services to the population of families with unmet needs. So in 2022, they were able to service 170 individuals. Demographics are more that 19 to 59, which is what they're targeting. There were some younger and a couple older. They're, again, you know, as many of our agencies, they're kind of, you know, spread thin, but within 7 days of a referral, 75 of those referred will be assessed. And within 14 days, they will be in 75% will be engaged in services of some sort. Usually a 3 to 4 month span is what they're in the programs for. It's not that big of a deal. Again, there was a couple, the total agency budget deficit reported in this form does not match the deficit amount. And again, I think that kind of goes back to the last, you know, set of things. Sometimes things get a little skewed a little. So I'm sure they're on that to kind of clean that section up a little bit. They did have some unexpended revenue of like $8,717. And I think that was just due to like lack of staffing to probably run those programs. You know, other than that, you know, I think it looks, you know, really good as always. A suggestion by the staff was if potentially they're going to run into maybe having to return money at the end, maybe we could cut back on the amount granted. So that is all I had.
Yeah, and I can add on, my had notification drop down just right as I was trying to unmute myself. So I think, you know, I think one thing about this program is that they do a very good job of getting themselves out there in the community and letting people know about the different trainings that they're doing. It's CU Trauma and Resiliency is one of the trainings I hear the most about sort of in the circles I'm in. And I think the focus on structural violence, I think, is one that definitely is meeting a gap, like kind of looking at sort of more macro level violence, and especially focusing on reaching African-American community members and other people of color. I would be interested in knowing more about maybe what efforts might occur in the future to reach Latinx, Asian American, Indigenous populations in the community, as well as LGBTQ individuals potentially. I think there, I also would be interested in hearing more about the focus on working with individuals impacted by long COVID. That was something that was mentioned. But I think also the focus on sort of like training the trainers about trauma, I think, is so important. Lots of evidence-based assessments being used, a large number of collaborators. We had some good evaluation info in there. So I think my main questions are sort of in addition to some of the questions about outreach to additional demographics, is looking at, you know, what exactly is that requested amount? Because it seemed like maybe there was a discrepancy in the miscellaneous expenses that might have led to the question of if it's 132 or 131 that's being asked for. And that's the one that had been pointed out as, you know, potentially where that was happening. And also the priority that was selected for the application was a program year 23 priority. So selecting a new one for this upcoming year would be important as well. And that is all that I have.
All right. With that, I'll just let everybody know we'll do 2 more and just finish the Don Moyer Boys and Girls Club, and then we'll go on to the other agenda items. So the next one, if that's okay with everybody.
And if you wanted an answer, Molly, I can answer. I'm sorry.
Yes, sure. That'd be great.
So one of the reasons for the increase in funding is actually we want to increase the number of peer supporters to broaden the demographics of individuals we served. And so that is what the number is for, is to be able to do more outreach to populations that we see underrepresented. So the gay, lesbian, and trans community, definitely we want to do more intentional outreach to the Latinx community. So we want to find someone who was Spanish speaking. But if you think about, like, we were doing targeted work in targeted neighborhoods, and so we've been kind of sort of restricted there because we were doing work to reflect the communities. And as those communities become more diversified, we want to have people from those communities served. So part one, and then the second question that you asked was those communities, when we work with public health and we look at community violence data, have been overrepresented in long COVID data. And in that 40 to 60 population that we sort of have been working with, we've seen lots of complex health needs because they're overrepresented in the adverse childhood experiences data and haven't had the good linkage to care around recovery. So we see like the community violence, the equity, and the poverty issues all sort of intersecting. And so we just wanted to sort of make sure that that was a huge gap in like mental health and physical health that we wanted to sort of plug in, using peer supporters to help with that navigation.
That's great. Thank you so much.
Thank you so much. So the next Don Moore Boys and Girls Club program is a Community Coalition Summer Initiatives with Joe and Elaine.
Okay. So with Summer Initiative, it's an important program because when you don't have resources to go to buy resources, this is a program that's open to everyone who can be there. And I think as a society, Unfortunately, many of us have to buy those opportunities for our children, but this one doesn't have to be bought. And I think it's a continuous programming that the schools provide in many ways to fill in the gaps so that we're talking about community violence. If these young men and women are involved in something that's productive, it reduces community violence. They're asking for $107,000, and I mean, and it's an operating cost that I think is doable for us. I mean, I think as I look through what they propose to do in those months of the summer, it is definitely money's well spent. So, and maybe because I have a problem with labels, but serious emotional disturbance. I know it's SED, and that's a population I've worked with quite a bit, but I also like labels, and many of these young men and women coming in with trauma, and maybe they're not seriously emotionally disturbed. They just have some trauma to deal with. I don't have anything else to add. I mean, Elaine, do you have anything else?
Well, just to explain that this is the Don Moyer's Boys and Girls Clubs contracts this out to these services out to other agencies, I think between 10 and 14. And so the money, they take a 10% administration fee, because that's what they're doing, is administrating this whole this whole initiative, and then the rest of the money is allocated out to the programs who hired their own staff. And the staff, our staff, made a suggestion that perhaps more data could be gathered by simple surveys of the kids, just a little more information. This program's been around a long time, and we've learned a lot about it and how to work it. But a survey wouldn't hurt here and there, something very simple. And I like that they work around parents' schedules, and I think they have a couple of focus groups that are going or are going to be set up of parents. So that's good. To get information on what kind of ways to keep kids busy are working. And there were a few things, again, part of this perhaps rebooting of everything administratively for the agency. There were the things needed to be updated, like personnel forms had some names of people who no longer work there, I understand, and some issues with, numbers matching up. I won't go into all that because that's something that will be worked on by the staff. But this is, a program we've supported for a long time for very good reasons.
All right, and then with that, if there's no questions, I will go on to the last one we're going to do, which is the Don Moyer Boys and Girls Club Youth and Family Services with Elaine and Jen.
Okay, so this is, they're asking again for $160,000, which they did before, and the priority is the system of care for children and youth families, or that's what it was in 2023. This is a mentoring program run by as you see on the screen, the Youth and Family Peer Support Alliance. This is another one that's been going for quite a while. So this is parents can get help with navigating various systems more effectively, and they will learn from other families and trade information. So this is about helping parents to help their children more effectively, and focusing on families and caregivers of youth clinically diagnosed as having been impacted by trauma and the justice system, perhaps child welfare system. And this again is seems to me it is organized around the needs of the family, so they can meet in person or on Zoom. There were 25 served in 2023 and 10 so far. No, in 2022 and 10 so far in 2023. The note was made by our staff that the target numbers had been lowered the last 2 years, and I wondered why that was. And so that's one question I have. And then just one other thing would be to look for other sources of funding. We always ask that of agencies to try to do that, because I mean, we're basically funding this, but we have seen agencies and programs fail because they had only one funding source. So it's always for a variety of other reasons, but having one funding source is never a real secure way to go. So I would just point that out. But I did wonder about the target numbers, if that's a COVID thing or something else, why those were.
Hi, Elaine. My name is Regina Kreider, and thank you for your question. So COVID did play a big part in us rebounding from, with our numbers being lower. It played a big part in it because of, we would oftentimes get referrals from schools, and just really rebounding from that. And also, we had a little staffing issue. We had a peer supporter who had been with us for a while, who eventually took sick, so we wasn't able to take on as many people. She ended up becoming very ill, and so just looking, this is a very specialized position. In order to be a peer supporter at our organization, you must be a parent or a caregiver, having raised a child that has had mental health challenges and have been able to navigate multiple systems, and you're willing to share your story. So our role is very specific, and it's not an easy position to fill. And so that has impacted our numbers as well. But we are in talks with the hopes of this being refunded next year. We're in talks with some of the local school district to look at ways of strengthening our partnership with them to get more referrals from them for some of their kids that are struggling with behavioral issues, behavioral challenges, because schools is a system, and oftentimes those two things go hand in hand. In regards to the funding aspect, up until last year, we had blended funding. We had a federal grant from SAMHSA for 6 of the 10 years that we've been funded. Last year was the first year that we did not renew that grant because of just refocusing some things. We also do some consulting and technical assistance and support that brings in some additional funds as well. But we are looking at what to do about that this year. But last year was the first year that we did not have additional blended funding for this program.
Yeah, I do remember the SAMHSA. Okay, thanks. Good answer. Thank you.
Thank you.
And I'll just say that I had very similar questions about whether the change in the target was based on need or agency capacity, and the funding, and Ms. Kreider more than answered it. Otherwise, I think that this is a really solid proposal for obviously a very needed service.
All right, thank you very much. With that, we will move on to the next item on the agenda, which is the Mental Health Board and DDDB schedules and MHB timeline on pages 55 through 59 of the packet.
So you can see, very importantly, next week, And we're gonna we'll do this remotely too. At that study session next week, the only thing that's scheduled, and hopefully you have the agendas, the agenda is posted. You'll use this packet again to review the other 25 applications for funding and discuss. So otherwise, we're not changing anything on the schedule for right now, but it is something we're going to have to think about. We need to add a month in between April and May. And I've been trying to figure out how to do it and I just can't. So someday we're going to crack that code. Anyway, that's all. No other changes. But we'll be back to in-person in May.
All right. With that, we'll move on to any agency input. So we'll reserve that to 5 minutes. If there's any agencies now that would like to make any comments, now is the time. All right. Seeing none, we'll move on to the Champaign County Developmental Disability Board input. If there's anyone that would like to.
I'll do it. They met this morning. They got through all of the funding requests. And we are probably, we're going to have to do a little bit of work between the two boards to identify two things, to make sure that both boards are comfortable with what the mental health board DD set aside dollars do, how you're making that commitment this year, and also what to do with that special initiatives fund. Because there actually were some applications to both boards that fit really well with those priorities. So they're ready to take that on. You might be almost ready to take that on. Then they're having a meeting May 17, hopefully to review staff recommendations and make final decisions about awards. So that's the big update there.
Awesome. Thank you, Lynn. With that, we'll go to, so there are no staff reports because of the request for funding review. And then the next item will be the board reports. Are there any board reports?
Yes, I have one. I attended the, excuse me, the Community Coalition monthly meeting. And just a couple of things of note. Of course, Ebert Fest and the art show Saturday were announced. Chandra was there to do that, but we heard from the Urbana interim police chief about the problems with fentanyl in the community. Just overwhelmingly frightening. He titled his talk, "One Pill Can Kill." And then we also had as a guest Gregory Harris, the U.S. Attorney for the Central District, who has been sending a representative to Community Coalition meetings, he said, and Champaign is, in his eyes, a model because of that Community Coalition and the way it is bringing agencies together. And I think we can pat ourselves on the back for the funding we have put toward that initiative. So he was very complimentary. And his main issue is, of course, gun violence. So, and how all of this is affecting, everything, including the things that we worry about. So it was a very, very intense and sobering meeting, but very interesting and informative. That's it.
All right, thank you, Elaine. With that, are there any other board reports? Seeing none, we'll go on to board announcements. Given no board announcements, we will move to adjourn. All right, well, I guess we'll see everybody next week.
Okay. All right.
Thanks for all the hard work. I know it was not easy. Thank you.
166 hours.
Ooh.